we have a hospital vision of serving a global community. And what we've done here at the hospital is ensured that it was embedded in our strategic plan.
So for organizations just starting the journey, I'll share a couple of things with you. And one is that based on my experience from when I first started in this kind of work, how overwhelmed I felt, how I didn't know where to start. I didn't know what to do. I did a couple of things that helped me. One of them was to find out what others are doing nationally and internationally when it comes to working with, for example, internationally trained professionals, when it comes to working with newcomers who are on staff in the organization. There are many frameworks and standards and practices that are out there. The US has some great ones, Europe has some great ones, Australia has some really good ones, Canada has some great ones. So I think I spent at least a couple of years, if not more, and I still do this, but at least a couple of years, quite a bit of time during those first 2 years in terms of finding out what's out there, what are some of the practices, what are some of the learning.
We started because of a need to actually help and support these internationally educated nurses that were coming, and on a need for the managers to understand what their role should be in supporting them.
We created a committee, and that committee specifically focused on how do we integrate internationally educated professionals, how do we attract them, how do we integrate them into the Sunnybrook culture, and what support do we provide to these individuals?
We started by employing a method of doing some focus groups with the IEN themselves, and ESL participants, with some supporters, informal mentors, which we call them clinical integrators, and also focus groups for the clinical managers. And just by working together, we develop a model, which is called Community Collaboration Employment Model, that kind of bridges the gap for the integration of these people, the IEN and ESL.
In our strategic plan that we had between 2009 to 2015, it was very much focused on creating a framework, a diversity and equity plan, doing extensive community outreach that's reflective of the diversity of our patient population. And now with our new strategic plan that's 2015 to 2019, we've taken a deeper step forward as we look at health equity. What are the health disparities amongst our patient population, and how do we address that? And how do we look at our staff population and harness the potential of our staff population?
One of the things is doing a demographic survey of our organization. I think it's important to know who we are. So we are moving towards that. That's something that will be happening in the near future.
This year in 2016, we conducted a staff demographic survey as part of our employee engagement survey. And we did it part and parcel so that we wanted staff to know that this was not seen as something separate in a separate entity, that their engagement and their opinions are important, and it also is important for them to self-identify and participate in a diversity survey concurrently. And what we found was that our staff population is actually quite reflective of the Scarborough population that we serve. And what we're now doing is taking a look at the data to say, okay, now that we know that we have a number of IEHPs, what kinds of programs do we need to develop to further deepen their inclusiveness and equity within the organization? We looked at the data around, say, sexual orientation, and the reality is that people are not coming with that one-dimensional identity. I am not just an IEHP, I'm an IEHP that might be of a specific ethnocultural background, a religious background, sexual orientation, and so it's not easy to unpack. And so creating an inclusive workplace is not just looking at you from the singular lens that I am an IEHP, is looking at you as the whole person with all of the dimensions of your identity that you're bringing to the workplace. And so really this is a great opportunity, and I advocate for every organization to do a diversity survey and really then to say, okay, well, who is not represented here? Who is not working within our doors, and why are they not here? And what is it that we need to do to attract and retain those individuals?
Research, we've just developed this in the last couple of years in terms of having studies in place that focus on, for example, when somebody doesn't speak the same language as the healthcare professional, what are the outcomes and the impacts? Having that research, having the evidence, really hits the messages home to people.
There are a lot of existing resources and existing information, which I think we can share.
Why try to reinvent the wheel when something is already created and you can take it, pick it up and go with it, and even adapt it to your organization?
So we have a framework in place, we have a strategy in place, but it's not set in stone. It should never be set in stone. It changes, it evolves, it grows, it develops as new needs are identified.
Once that's in place, I say, definitely a steering committee and a working committee. And your working committee can also be individuals who are not part of your organization. I will suggest that it's co-led by human resources and an operations lead. I honestly feel that if initiatives are not aligned and integrated and are co-led with an interprofessional team, it just becomes so much harder to really get the real essence of what you're trying to accomplish. And by doing that, it allows for the change to take place, to see the change in behaviors, to see the change in results.
And I truly believe that what gets measured gets done. And if it's not in your strategic plan or your business plan for that matter, then it probably will fall on the wayside. So I would say that if you're looking at some key ingredients, I would say that you definitely need to look at a business plan or strat plan that really has a commitment over a number of years to support diversity, equity, and inclusion. Because you can't have a diverse staff population if people feel that there's not equity. And if there's not equity, then there isn't inclusion.
One of the things that I think is really key to ensuring that a program like this is successful is getting the senior leadership buy-in.
You need to involve everybody as stakeholders, or if I can go a step up, shareholders at the table.
Leadership at the Scarborough Hospital is not only focused on playing a key role with diversity, it is actually pivotal in role modeling and in creating an atmosphere where diversity thrives.
At the bottom level, you really need that support and sponsorship because staff will adopt a policy and programs if they know that they have the support of senior management.
It's our senior leadership team, very knowledgeable, very passionate, very motivated because they all know that if we didn't have a focus on diversity or equity in the organization, there would be challenges in terms of inclusive work environments, i.e. they would be exclusive in how we provide equitable patient care to all our patients. And so they get it.
We do want to attract the best, and when they come here, we want our staff to be able to grow their career and to achieve excellence here. So when we attract internationally educated professionals to the Sunnybrook family, it's really important that our leaders are equipped to help with the transition. So we have created a leader's guide on attracting internationally educated professionals to help our leaders be better equipped to help to integrate our new talent.
Education and awareness is one aspect of leadership commitment, but it's also about ensuring that all of our leaders are held accountable for a commitment that's embedded in the strategic plan. And so as a result for us, we have identified that in our mandatory leadership development that includes bias-aware education. It's also part of our 360 leadership assessment where all leaders are assessed on their leadership capabilities, and we have key components in there that really addresses a diversity index that they're rated on, and that really helps to identify in what areas that they can actually develop and grow on.
That's the meat of the success story. We had the funding, that was good, but we need the support of these people.